welcome back to Adulting Anonymous, the podcast. My name is Kudzai, your host, and I am so glad you could tune in. August being Women's Month, we at Adulting Anonymous have decided to bring you a series of conversations with powerful women that would not only empower you, but that would leave you with so much information to help you grow into being a better woman. In this episode, we are going to be discussing women's health and the link it has to women empowerment. And when I thought of who I was going to invite on the pod to discuss and tackle this issue, it wasn't a brainer actually. I had to invite my high school friend, Dr. Tadala Muleni, who is a Malawian born, South African raised, powerful, hardworking young woman. From high school, she was a go getter, and I don't think anything has changed to date. So I'm very excited to introduce her to you, to present her to you as we tackle this discussion. And before I go any further, I'm just going to hand over to her so that she can tell us about her journey, and we'll take it from there. So Tadala, welcome to the podcast.
Thank you so much, Kudzai. Hello, everyone. Thank you for joining us today, and thank you for the invite as well, Kudzai. So, like Kudzai said, my name is Tadala Grace Palamuleni. I'm a doctor by profession, and yeah, I've been on this journey for 5 years now or so. So, when you say I should tell you about my journey, where did it start? I think I've always known that I wanted to be a doctor, although growing up, there are some parents who always say, hey, I want my daughter to be a doctor. Well, my parents did not want me to be a doctor, honestly, but my stubbornness.
What did your parents want you to be?
Well, my dad is he's a mathematician, he's a statistician, and he's more into the economics kind of thing. So he's more like, you should be an economist, you can be a chartered accountant like you do. But I was just not about that life, I was like, you know what? Everyone in my family, like from my dad's side of the family, they're either into mathematics or economics. And I was like, let me be a pioneer.
Nah.
It's still breaking up.
You wanna heal people.
Yes.
What contributed to, okay, I guess you just wanting to go a different direction from everyone in your family.
Yeah.
But was there, now that you're a doctor, do you ever look back and think maybe you should have gone a different way, or are you still very passionate about your job?
I should say I'm still very passionate about it. Maybe, yes, when I was still young, I wanted to be a gynecologist, the obstetrician, but we'll see along the way. But along the journey, I've realized that I don't think I want to do that anymore. Maybe I will, but I just don't enjoy the cutting of things, like being in an operating theater and doing that. But the passion is still there. Trust me, when I tell people that medicine, I mean, you don't choose medicine, it chooses you. It's true, because sometimes, in as much as everyone wants to do medicine, and yes, thank God in South Africa, doctors are paid better than in other countries, if I can put it that way. And some people go like, no, it's because of the money, that's why you joined. But I do not wake up at 2 a.m. because of the money. That's true.
Yeah.
I wake up because, you know what, I want to save a life. I want to do better. I want to say, I've done my best, and I'll leave everything else in God's hands. The thing about medicine, it's a very taxing career, if I can say so.
Hectic. That's actually so interesting because, like you said, in South Africa they do pay doctors better than other African countries. I know the Zim doctors are also not having like a good ride.
Yeah.
So I guess it's nice to see your passion not being fueled by monetary remuneration, but I know it is rewarding in that sense as well.
Yes.
So I just have a question. What did it cost you to become a doctor? If you look back on your journey, what sacrifices, what would you say it cost you?
For one, I think it cost me a lot of friendships, if I'm honest. Friendships, I've lost a lot of friends. I've made a lot of friends, but along the way, I lost them as well. The other
Mm-hmm.
thing, it's emotionally draining. I mean, it's surprising that you'd be like, but this is such a noble career, but it's amazing how many doctors are actually depressed because it takes
Yeah.
away your everything, you know. You don't face criticism from not only the patients you're taking care of, but you also face criticism from your colleagues, from your teachers, your
Yeah.
seniors who are above you. They also weigh you down in a way. They are trying to
Mm-hmm.
change that, like in medical school. My journey in medical school was not that great. I went
Mm-hmm.
to Wits University, and I don't know if you've heard, like, there's a lot of racism associated with that. So I had to face
Mm-hmm.
also those encounters of racism and sexism as well as being a young black woman. Women in general are
Mm-hmm.
usually looked down upon, they're usually undermined. So it was a long journey, it was exhausting. And I know a lot of my friends who are actually on antidepressants because you can't just take it anymore, you know? You can't face it anymore.
Yeah.
And yeah, you just want a
I,
way
I
out.
I definitely can relate to the being a young black woman, and now you
Mm,
want to be a doctor, which is a while previously had been a
yes.
male dominated industry. And then you've got race working against you, you've got gender working against you,
Mm,
and somehow you have to rise above that and still be excellent and perform twice as good for them to even look at you, and
yes.
one slight mistake and then they're on your neck. So
Yeah.
I totally get that. So thank you for sharing that.
Yeah.
Um, so diving into today's conversation, what would you say? What does woman empowerment mean to you?
So, women empowerment for me, it's well, if we use the general sense of the meaning, it means to strengthen someone, right? To give them strength in every area of what they're doing. So for
Mm-hmm.
me, it looks at being independent, being emotionally
Mm-hmm.
stable, being physically healthy, and also being, if I can say, financially stable, independent as a woman, doing your own thing, not depending on a man to do
Mm-hmm.
something for you, but you standing on your own 2 feet and saying, "Yes, I did that. Yes, I achieved that. Yes, it's Tadala who has done this." That is empowerment to me.
That that's powerful. Basically saying, from a holistic point of view, you can stand on your own without
Yes.
having to depend on anyone. I love that. And
Yeah.
what do you think, from a health perspective, how do you think women empowerment, per your definition, how is that linked to a woman's health?
So let's bring into the scenario a 12-year-old girl, right? So
Mm-hmm.
when there's a 12-year-old girl, they're almost at that stage where they are almost into puberty, but also,
Mm-hmm.
they are also into becoming a young woman, per se, right?
Yeah.
And there are a lot of things that can either make or break you at that point. And I'm going to bring into the scenario where you find a young girl who's sexually abused, right? And
Yes.
if she's been abused by the abuser, they're going to give them infections, not only sexually transmitted diseases, but there's also an emotional trauma of that woman, right? Of that young
Mm-hmm.
girl. And if she goes to the hospital, maybe let's say she's asking for contraception or she's asking for TOP, the first contact she gets is maybe a nurse, and this nurse looks at her and says, "At your young age, what are you doing with that?" You know,
Mm-hmm.
already this girl is broken emotionally because of the rape that she encountered. And yet, when she goes to a fellow woman, she's also being disempowered. There isn't anyone saying, "Oh my girl, thank you for coming here. Let me teach you about A, B, C, D.
Yeah. Yeah.
Let me teach you about sexual health. Let me teach you about taking care of your body. You know, let me tell you how you can become a better woman. Let me teach you, not tell you, but teach you of ways of becoming a better woman and being more body aware and being more like sexually empowered as well." Because I think in Africa, I mean, tell me if I'm wrong, I never grew up being taught about sex. I had to
I
learn it
also
from
I
home.
also didn't. I also didn't. It's something that was very seldomly spoken about in the household.
Yes.
In life orientation, we had the textbook answers, which obviously don't dive into the real issues that you actually experience. So it's
Yes.
not about as much as it should be.
I mean, it's kind of like taboo in an African family to talk about sex. It's only maybe when you're
Mm-hmm.
graduated that's when they're like, okay, now let's start talking about it. But no, it starts at the age of 12. Not even younger.
Yeah.
You can start younger than that because nowadays, we're advanced in the sense that TV also shows us these things. And if you don't teach a girl child how to take care of their body and they see it from TV, they can mimic the things that are happening in TV and end up
That
endangering themselves.
that is true, and we'll dive a bit into that. So basically, if a person is not healthy, like they're not given the necessary knowledge about how their body operates or what resources are available to them in terms of their health, then basically what we're saying is we're taking away a factor that could actually lead to this person being empowered. True or false?
Absolutely. That is true. That is true.
So, in your scenarios, you mentioned a sexually abused child. You mentioned a young girl who's transitioning into being a teenager, for example. So they start, experiencing changes to their body and so on and
Mm.
so forth. But as a medical professional, what have you observed, like during in your day to day work, especially specific to women? What would you say you've observed that concerns you, in terms of the cases that you get, and when you're carrying out your job? What would you say concerns you from your observations?
What concerns me a lot is the health seeking behavior, or even we can say the help seeking behavior of women in general.
Okay.
Like I mentioned earlier on about the scenario where a young girl goes to the clinic, asking for a contraception. That's very, I think, and I've seen a lot of celebrities who have mimicked some of that. Like Lasizwe also made a meme about it where he compared a private um, clinic nurse versus a public clinic nurse, right? They'll shout at you.
Yeah.
The first thing you encounter is that you are shouted at, you are ridiculed, right? And
For asking for contraceptives.
for asking for contraceptives, yes, that's the first thing
Yes.
that I've seen.
Mm-hmm.
The second thing is, let's say a woman comes in, when we talk about a sexually transmitted disease, the first thing they'll say, I've got discharge down there. It's not the normal yellow discharge that I notice every day. I mean, it's not the normal whitish discharge I notice every day. It's
Mm.
now foul smelling. It's now this. The first thing, instead of now trying to say, okay, look, maybe I think it's ABC, what do healthcare professionals do? I mean, they go like, what were you doing? You know? And
Yeah. Yeah.
a
Yeah.
lot of women are actually even scared to go to the clinic to get help, and once they do come to the clinic, it's complicated, it's become worse, and now even me as a doctor will be like, why were you late, why didn't you come earlier on? But if you look back, you go
Yeah.
like, maybe she did. It's just of the way she was, like the way people approached her or the way she was seen, you know, the way she was treated that made her retreat back and not say, I won't go there, I'll seek other kind of help.
Yeah, yeah. And then when they seek other, because now they're so scared of being ridiculed or
Mm,
humiliated, they go to different places which aren't even like legal sometimes, and sometimes
yes,
it's not necessarily hygienic, and then their lives in the process, I guess, get like your health gets compromised. Some
yes.
even die, and
Mm-hmm.
yeah, I guess that's very concerning.
Yeah.
So I want us to discuss, you brought it up
Mm,
earlier, I just want us to discuss reproductive health, like
okay.
menstruation and all that jazz. What would you say where do you think we're missing it? I mean, you mentioned that no one talks about sex, but do you think as a society we are educating our girl child enough about menstruation and what to do, and when they're going through it, and how the body actually works during that process?
I think now, if I look back when I compare to when I was starting my periods to now, I think we have improved a lot.
Mm-hmm.
Now there are more images. I think there are more. If you go to some clinics, let me not just say all of them. There are some where they do health education talks, and if I bring into the other aspect of it, it's the HIV/AIDS clinics. Also, they also have this thing of where you have teen clubs or youth clubs, and in that way they discuss different things about menstruation, how your health changes. And I've seen you're also one of the people who were also campaigning for pads for young girls to do. So those things have actually improved in the sense that we now teach young women, we teach upcoming children or girls how to take care of their bodies, what to do when they experience this. But one area I think we still lack is the area of contraceptions, because there's
Mm-hmm.
still, if I can say, a misconception or a misunderstanding in the sense that if a girl wants to use contraception, then they are having sex. I think
Yeah, yeah.
I think let us cancel that out, because it's not about having sex, but they want to prevent, an unwanted
Mm.
pregnancy for say. But that's not what contraceptions do. Yes, that's one of the things it does, but it's not the only one, you know. Contraceptions can also help if, for example, a young girl is suffering from what we call dysmenorrhea, that is painful periods, which,
Mm-hmm.
they'll prevent you from going to school, prevent you from maybe doing your daily activities. I don't know. Some women experience very bad period pains. I'm one of those people. And when you use
Mm.
contraception, some contraceptions can actually help with regulating your cycle, can help with reducing the period pain, and you are able to go around as if it's a normal thing, which it is supposed to
Yeah.
be normal, and you're not supposed to suffer from it. So that's one of the advantages of having contraceptions, in the sense that you're also regulating your periods.
Hmm. That's very, very interesting. So, what would you say are some of the health challenges that women face based on what you observe in your day to day work?
So the most, like the biggest one that encompasses everything would be the health seeking behavior or help seeking behavior of women. Because
Mm-hmm.
the thing is, we live in a world where people judge one another, and
Yeah.
healthcare work healthcare workers are the most judgmental people I've also ever met, because you find that maybe, let's say, a 12-year-old girl or a 14-year-old girl has gone to the clinic to ask for contraception. The first thing that comes to an African woman whom you will encounter at the clinic, or a nurse, if we can say so, is, what do you want to do with that? Because the misconception or the misunderstanding that we usually have is that if you want contraception, if a girl is asking for contraception, then they must be having sex. But
Mm.
that's not the only biggest thing or the only use of contraception there is. You can use contraceptions to help regulate your menstrual cycle, and a lot of women face this challenge of when they're having their periods, they encounter period pains, and some of the contraceptions that are in use can actually help in regulating that period pain, like in minimizing the pain, if I can say so. And that will
Mm.
also reduce, the number of days that a child or a girl child misses to go to school or to go
School.
to work, because that's actually one of the worldwide causes of, if I can say, truancy at school, where
Mm.
a girl did not come to school because they were having period pains, you know?
Yeah.
And
So and what? So what's you mentioned earlier that I think the condition is called dysmenorrhea. What's the
yes.
difference between that and endometriosis? I think I said it right.
Yeah, endometriosis. So dysmenorrhea, it just means painful periods, right?
Yeah.
Endometriosis is a condition that you have. So if I have to bring into anatomy of the uterus, right? The uterus is
Yeah.
the organ that, well, it helps carry the baby when you're pregnant, right? So the uterus has
Yes.
got many layers. So there's the myometrium, the muscle in there, and then there's also the layer called the endometrium, right? So when you have
Mhm.
got endometriosis, you have got overgrowth of that layer, which can cause,
Mm.
one of the symptoms that you may have is dysmenorrhea, dysmenorrhea of painful periods.
Mhm.
Sometimes women will also encounter what we call painful sexual intercourse, you know. And most of
Yeah.
the time, when you can actually diagnose endometriosis, or when you start thinking of endometriosis, is when there's maybe, let's say, a 25-year-old in their childbearing ages, and they say, I've been trying for many years to have a child, but I'm failing. But also,
Mm.
doctor, I've been encountering painful sexual intercourse. I've been encountering painful periods or heavy periods. In that sense, that's when you would go like, oh, maybe endometriosis could be the cause, you know. And the only time you can
Mm.
diagnose that, if you take a tissue sample or a tissue diagnosis to go test up and see if that is it. That is one of the causes for it. So that's the difference between
Wow.
dysmenorrhea and endometriosis. Yeah.
Wow. Okay. And I guess as a young woman who's just
Mm.
going about in her um or like just going about life, I guess what you're saying is if I experience overly painful periods
It,
and I need to have it checked out because it could be one of those, because
it could
sometimes we
be,
just
yeah.
say, sometimes we just it's painful and then you just take painkillers and then you keep it
Yes,
moving.
yes. And also another thing could also be fibroids, you know.
Oh,
Yeah,
yes, there's
fibroids
that.
is just also overgrowth of the, what is this? It's tissue overgrowth. Should I say reproductive organ overgrowth in the, it can be in the uterus, or it can also be outside the uterus.
Mm, okay, so yeah, that's very important to note. Thanks for highlighting that.
Yeah.
I'm going to read a stat for something we're going to discuss now, and it
Okay.
says, and I think it's very important because um, I always scroll through social media, and the next thing you see, like a pregnant woman who passes away during childbirth. And when I was like reading up on it,
Mm.
there's something that was written that caught my eye, and it says
Mhm.
546 for in Africa,
Mhm.
540 for every 100,000 live births, there
Mhm.
is 546 deaths
Mhm.
which were reported, and this was in 2017 or something. So I guess my next question is how what causes I don't know, because I don't
Mhm.
really understand how I could just be trying to give birth and the next thing we're both dead. How does that happen?
Yeah.
What happens there? Yeah.
Oh, hectic. So, how can I say? I think, in my, well, I'm from Malawi, so they usually say a pregnant woman is sick, you know. And I never
Yeah.
really understood that concept until I got into medicine. That's when I was like, oh, okay. So with pregnancy, the thing is, you everything doubles in size, you know. When they say
Yeah.
you're eating for two, it's true. It's like you're
Uh,
bringing this new human being into the world, but when you're pregnant as a woman, you're breathing for that child, huh? You're eating for
yeah.
that child. So even your body supply, so your body, you have body changes that happen during pregnancy. One of it is that
Yeah.
your heart is now pumping twice as hard because it's also breathing for that child. It's also providing blood, or what can I say, or food to that child, right? So
Yeah.
one of the many causes of maternal deaths, right, it's hemorrhaging, which is bleeding
Mm,
a lot.
yeah.
So when you do give birth, you do lose a lot of blood, right?
Mm,
But if you start losing more than 500 mils of blood, so let me say, you know, a 500 ml bottle, right? If you lose all
yeah.
that large amount of blood, we need to do something about it very quickly. But you cannot preempt What I mean by that is, I
Ah.
cannot tell when I see this pregnant woman, I'll be like, no, maybe she's going to die. Yes, as a healthcare professional, we are aware of those risks that she's going to bleed a lot. So we look out for those things. But there's no way I can predict that this woman is going to die or this woman will not die. That's why it's always advisable that you must attend your antenatal or your prenatal classes so that at least we give
Mm.
you supplements. I'm not saying
Mhm.
that that will prevent you from bleeding a lot, but at
Mhm.
least we're trying to prevent that if you do bleed a lot, at least you still have a reserve. You get what I mean?
Mm.
Yeah.
Yeah,
So,
no, because
uh,
it's sad because I mean once you're trying to give birth and the next thing you're dead, and
yes.
I guess
Mm,
it's just ridiculous from my side. Another issue I wanted us to talk about
yeah.
is HIV and AIDS. What do you think is the correlation?
Uh-huh.
Again, I did some research, and
Okay.
in Africa, and this was based on the World Health Organization
Mm-hmm.
in 2018. So they
Uh-huh.
say in Africa, there's 38 million people who are living with HIV
HIV
and AIDS.
AIDS. Yes.
And of
And
that 38 million, 18 million are women. So more or less 52%, 52% of the cases in Africa are women. And they basically say that women have a higher susceptibility to having HIV and STIs when compared to men. What's that about?
okay, so it's a kind of a complex thing. So, but it all has to do with our anatomy as well.
Yeah,
So
yeah.
the thing about our anatomies are different. That's why they also advocate for males to go circumcise themselves. You know, if they
Mm,
when they remove that foreskin, the foreskin actually carries a lot of germs. You see, so when you
mm,
remove that, you're actually minimizing the contact between you and your sexual partner. Whereas with a woman, you know, there's no that you can't minimize that contact, you know. The
yeah.
vagina is very a friable area, it's very delicate area, and once there's that friction, there's usually a breach, you know what I mean.
Mm,
As some people,
yeah.
okay, yeah, when people have sex a lot, they're going to complain of, oh, my vagina is painful, you know, I feel like I tore my vagina. So there's usually, when there's that friction during sexual intercourse, the vagina is more likely to tear, and whatever sexually transmitted disease that the other individual was carrying will be easily passed along to the woman. The other thing
Oh, okay.
about that, why there is more records of women who have tested positive for HIV, is because women go to hospitals more than men. You see,
Okay.
and
Oh,
the
okay.
reason,
Oh,
and
yes.
even nowadays, it's a prerequisite that when a pregnant woman, or let me just say, when a woman goes for their first antenatal visit, we're going to do what, an HIV test on them, because we are also trying to prevent that transmission from the mother to the child. That's why
Child.
you'll find that
Ah,
there's more women who are HIV positive than men. That's not because men are also not HIV positive, no, but it's because men are not going to hospital.
and men, I guess it also goes back to like the empowerment thing. If
Mm,
you can't have kids, if a couple can't have kids, 90% of the time, well, I'm just estimating, yeah,
yeah,
the blame will be on the woman, that the woman is the one that can't have kids.
that has a
And I mean,
problem. Yeah.
exactly. If
Mm,
with HIV and AIDS, I mean,
mm,
like the woman's always constantly, I mean, taking care of themselves. The men are supposed to be tough. You know, you can't be seen in a hospital. Some of our parents are
yeah.
actually like, no, a hospital. I don't want to go to the hospital. I'm fine. And I guess this again, it's like a coronavirus thing where some countries have high, higher cases. Um, some countries have higher cases of positive cases confirmed because they're doing more testing, and
Yeah.
I won't mention which countries, but then they're like, oh, we don't have cases, but whilst they're not doing any testing. So I guess that's
Exactly.
also important.
We won't name drop on those countries, but yes,
we
we know
won't
it.
we won't we won't name drop.
Yeah.
There's also this thing. I think one thing I've also noticed
Mm,
is that from from a woman perspective or from a girl child perspective,
Mm.
if you can't like go to school, or if you can't fend for yourself, or if your parents don't have the resources to like take you to high school. I know in Zim it's usually go to school, get married, have kids, and that's the vibe that goes on.
Yeah.
um and I think, would this not also be one of the contributors as to why more women are like positive or test positive for HIV and AIDS, in the sense that you don't really have a choice but to be, you are like this object of sex
Yes.
to a person who's busy doing other things with their life. So if I was busy studying and occupying my time with, you know, chasing goals or career or business or whatever, then there's no time for me to be having sex, or even just, I mean, having sex is not the only way you can transmit the disease. But then is there a correlation, I guess, between women or females that basically are occupied with their careers or are afforded opportunities to have, you know, to further their studies or careers or business, versus the ones that don't?
Well, there is. I mean, I've also been in Malawi, and there is this. There are a lot of, how can I say, teenagers who are married to these older men. If I can say, what are they
Mm-hmm.
called?
Yes,
Teenage
yes,
marriages, and
that's true.
it's that poverty thing. They think that,
Mm,
okay, if I've got this young girl, she's now of age, she's able to give
mm,
us a child. If I marry her off to this old man, she'll be able to what? She'll be able to fend for herself, or she'll be more richer than I am as a parent.
exactly,
Yeah, so
exactly.
yes, there is a correlation, because now this girl is most likely illiterate. You know what I mean?
Mm,
And she doesn't have that, if we can say, empowerment, of making the right decision, of saying, or of even advocating for her own health, to be like, hey, listen, I'm married to this old man, but can we use condoms? You know what I
and then
mean?
he'll be like, no, yeah,
You'll be like, no. So you're kind of disempowered in that sense of, where I don't have a voice for myself, because this is the
yeah.
man that's providing for me. And
For me, exactly. If I say no, then what am I gonna eat, or what are my kids going to eat,
yes,
etc.
yes, yeah,
That is hectic. That
it
is hectic.
is. It's very
So
sad.
just one last one, right?
Mm.
Domestic violence. How many? What, from a medical professional's point of view? I like saying that. Like, it used to be Tadala, what do you think? Now it's like from a medical professional's. Sorry. Okay, cool. I digress.
Yeah.
But what role does domestic violence play in disempowering females, based on what you've seen, like the cases that come in and so on and so forth?
It plays a very huge role. It does play a very huge role, because now, one, the thing is, abuse, most people think abuse can is just physical, you know.
Yes.
But there are many forms of abuse. Emotionally, you can be abused. Financially, as well, you can be abused. So, with that sense, because now you don't have, well, with me, I was brought up in the sense that, hey, listen, yes, you're a girl, but you can do what a man can do as well, you know?
Which is true. Which is true.
Whereas now with this woman, let's say sometimes, if I can say, abuse is kind of like a cycle, right? You see your
Yeah.
mother being abused, and you think,
Mm,
that's the way I'm supposed to be treated. And you get
mm,
into this relationship with a man who treats you poorly, and you say, you know what, hey, this is life. My mom went
mm.
through it. I'm also gonna go through it. And in Africa, I don't know if in your country you have that, but in Malawi we have this thing of, they say ukapilile, in the sense that you must go ubekezele. In Zulu, that's how you say, you must persevere. Is it persevere or
Yes, you must, like they're basically saying in Shona they say mushamkadi, you, yeah, like shinga, like be brave or be just stay in the house until things get,
Yes,
you know,
yes. Until someone leaves in a body bag, that's when they go. But she never said anything. No,
anything.
guys.
But
It just starts with
the
a
aunties
small.
were telling you to be strong.
Yes, but someone told you to be strong. And in that sense, a lot of women actually hide, you can see a woman who's being abused, they'll come to hospital, and you go like, hey, who beat you up? I know it was actually my fault. Now the abused is defending the abuser, you see.
Yeah, the
And
victim to say, I know what I said was wrong.
yes,
He has a short temper. Next time I'll do this
yes.
better, and so on and so forth. Yeah.
Yes. And you kind of hide away from saying, hey, I'm not physically well. He gave me HIV/AIDS, but you know what? There's nothing I can do about it. So domestic violence does have a huge role, and sometimes women are actually even afraid to come to what? To hospital. It all goes down to that part of also, as healthcare professionals, I'm actually trying to work on it. Trust me, sometimes if you find me at 3 a.m. in the morning, it's difficult and you just want to get things done, and you shout at the
Mm,
person and be like, but why didn't you come earlier on? Why didn't you? But it's something that we also have to stop, to be like, hey, let me listen to this person. At least she came when she did. Let me
mm.
do something about it so that maybe next time, if I treat her well, she's able to come to me quickly, you know,
Yeah.
before
Yeah,
she
that
actually
must be
appears in a
that.
body cam.
That must
Yeah.
be hard to I'm saying that must be hard to actually navigate around, to say how do I help this woman, and how is your mental health affected in when you see these situations as you do your work, and how
Oh,
do you deal with it? I know I've asked you this before offline, but
yeah.
how do you deal with this?
It's messed up. I'm not gonna lie.
Mm,
Because as okay, everyone always says, but you have an oath, right? So sometimes
mm-hmm,
it's up to the woman's discretion not to report it, right? And you
mm,
actually, I'm emotionally a mess. I'm not gonna lie to you,
mm,
because now I'm thinking, hey, I grew up in a, if I can say, a relatively perfect home. I was never
yeah,
really abused by, I grew up with around a lot of men. I never
mm,
experienced it. But now here's this woman. I want to let her know that, hey, not, I know men will be happy about this, but not all men are like that. Not all
mm.
men beat you up. Like, you can find a man who supports your
Who
dream. You can
treat you
find
well?
who will treat you well. And so, how do I deal with my mental health? For me, God is my number one, because He has
Mm,
brought me through a lot of hurdles in life. If I had to
mm,
tell my story, the journey that I've been through, God has always been my number one. Yes, there were sometimes I doubted Him, but I always go back to Him to be like, God is my burdens,
mm.
is this broken heart of mine, I'm saddened for
Yeah.
this person. And I always say, you know what, I am not God. People will come
Mm,
to you and they are on the brink of death. All I can do is, let me support this person until it's the right time for God to take them. Because
yeah.
like I said, life and death is in God's hands. We are just here
Yeah.
to, if I can say, to prolong it or to make the journey easier.
Yeah, you guys are just being used as agents to either
Yes.
ensure, you're like an agent ensuring a person either stays alive or
Yes,
dies,
but
I guess.
disclaimer, we
Sure.
do not kill people.
Yes, yeah, no, definitely,
Yeah.
definitely. You do all you can. No,
Yes.
that's interesting. So we've tackled quite a few issues. I mean, we spoke about HIV and AIDS. We spoke about the stigma around asking for contraceptives when
Yes.
someone has painful periods that people experience from healthcare professionals. Let's not get started with the humiliation when it's just like in community to say, "Oh my gosh, I'm on contraceptives."
Yeah.
We've spoken about domestic violence, and we've also established that this basically disempowers a woman, and
Mm.
basically we're already working against all these factors which obviously the other gender is not experiencing or is not facing. So
Yeah.
what do we as women and what do men also have to do to tackle these challenges? I mean, to um, to debug the certain myths and stigmas that we've discussed today, or to assist in, the issues that we've highlighted, such as gender-based violence. What should we be doing more to ensure that there's less of these cases?
That's a tough one. So it's always individual based,
Mm,
because we always say, what is this? They always say discipline starts at home, you know.
yeah.
So if your home environment with your parents, if you raise, okay, parents that raise men, right?
Mm-hmm.
Shouldn't have that, because there are some people who pump should I say pump make their kids pompous. You are a boy, you shouldn't go to the kitchen. No, you sit down, your mother will bring this. No, you are
The
the
gender
child of the
roles.
family. The gender roles as well, let's stop defining them. Let's stop defining what a girl can do and what a boy should do, in Africa.
Mm.
Well, for me in Malawi, it's always a girl is characterized or is identified by how good she can cook a pap. Hello, it's 2020. I hope there's a pap maker in the making nowadays. You know what I mean? So
Yeah, yeah.
let's stop defining how well a girl can cook pap and start saying,
Mm,
hey, you're gonna be a doctor, you're gonna be a pilot, you're gonna be an
mm,
engineer. Let's
mm.
encourage our kids to aim not to be good pap makers, but to be, better
To be
citizens of
whatever they want to be.
whoever they
I
want
mean,
to be. Yes.
and also teach your sons to be good pap makers as well, so that they don't
Exactly.
end up expecting a girlfriend who will be able to make pap nicely and beating up a woman or a girlfriend who can't cook pap because you
Yes.
didn't teach your own son how to make
How
pap
to
properly. I mean,
Yeah, it's about like, let's erase the gender roles. Let's raise children to you never hit a woman, and in vice versa
mm,
as well. Respect a woman, respect a girl,
mm,
because it starts by
mm.
when you see a young boy kicking a girl, in school, but then you go like, no, but they're just kids, they're playing. No, that's how it starts.
No, no, yeah, because then that's like an anger issue or violence, something that's not being addressed. You know what I mean?
And also, like, I'll always refer to Africa, African, like black African people, because that's the culture, or that's what I've seen mostly. I can't
Mm,
identify with other races. But also with this thing of, I'm going to bring up, you brought up the mental health. Let's stop saying it's because this person is bewitched. That's how they behave like that. Or no,
yes, justifying. Mm,
it's a demon in them. No, let's pray about it. Let's encourage.
mm,
There are psychologists available to talk about these things. There are social workers that we can go to. There are a lot of professions that you can seek help with when you see, hey, I see my child is depressed, or I see my child always cries a lot. My child has
mm.
behavioral. Let's seek professional help when we need to, and stop saying we'll pray about it, and stop saying no.
Amen, sister girl. I'm passing
Yes,
around the offering basket.
yes, and stop saying no. It's a demon that possessed this child. No, let's
Yes,
make
it's your address the root cause and
yes,
send the child for help. I agree
yes.
with you.
Yes, because now you can't be like, how they always say a man doesn't cry. No, let that
Mm.
man cry, let them
Yes,
release that emotion they have, because you don't know, one day it'll build up, and that's how they'll hit a woman, because of that
exactly.
anger where they're just keeping it in. And
No,
yeah,
that's definitely important. Um, Ensuring that we address how we raise our kids, for the future
yes,
generations, because it's ridiculous to actually think that a man will beat you up because you refuse to let him touch your ass
yeah,
because he grew up thinking a woman's body, he has rights to a woman's body for some
yeah,
odd reason, and I think this needs to be something that we highlight, especially in Women's Month. And I'm always saddened how during the month of August, that's when I guess these issues actually they
They come out. Yeah.
it's what they happen more in August, so it's more like they're spitting in our faces to say, oh yes, you're celebrating Women's Month, but look what we can do to you. And
Yeah.
I think it's ridiculous. I also wanted to ask, from what age, because we can talk about addressing domestic violence, but for the other health issues, I guess, like visits to the gynecologist and having pap smears and all that jazz, at what age should I be starting to, to go for these checkups? Because some people believe that if you're not sexually active, you don't need a pap smear, don't go to the gynecologist. Or, so what is like the recommended practice in terms of regular checkups and so on and so forth as a woman?
So okay, okay. That part of where have you ever had a pap smear done? That part of where, uh huh.
I actually haven't. I haven't.
Oh, okay. So that part of you don't do a pap smear when you're not sexually active. It's true because the instrument that we insert, it's called a speculum, and
Mm-hmm.
you insert that in a virgin, right? You're kind of like breaking their virginity. So it's
Oh.
not recommended for that. So usually it's for, yes, sexually active women as early as possible, as early as the age of 25.
Mm-hmm.
You can go to the gynecologist, but only if, okay, you can start going to the gynecologist for a pap smear. If you're HIV negative, then you can do it in 10-year intervals. You get what I mean? 25, then
Yeah.
35, 45. But for women who are HIV positive, it's different because there is a link between HIV and cervical cancer. You know, and I'm not saying that HIV negative women don't also get cervical cancer. It's just that it's a high incidence in women who are HIV
Mm,
positive. So they do recommend that if you're HIV positive, then if you have done your first pap smear, then you can at least do it annually thereafter to
mm,
check on cervical cancer to see if you're at risk for it. But then, and if they do find that maybe you are at risk of getting cervical cancer based on what they have seen from the cells they've done for the pap smear, then they can say in 6 months interval also. But yes, when you are not sexually active, or let me say when you're a virgin, then a pap smear is not recommended because then now I'm traumatizing the woman, putting them through much
mm,
trauma if they haven't had sex. The other thing is, let's make going to the gynecologist a habit, in the sense that you can also, yes, there are a lot of printouts now about breast cancer and how you can
mm-hmm,
self examine yourself, more especially after your period. You do a self
mm-hmm,
examination of your breast, and then if you find a lump, you can go to, excuse me, you can go to the doctor. But also there's, you can discuss women issues that you're having. You can be like,
mm,
doctor, which contraception can I use now?
mm,
I'm an advocate for contraception because I believe a woman should not have a child when they're not ready. You get what I mean?
definitely, definitely. Because
So
then that also eliminates the whole abortion story, which is another discussion on its own. Yeah.
yes, yes, it eliminates all of that, and it's better to take care of oneself and or sometimes you know how you have a child and then you are stuck in that relationship because you're doing it for the child, you
For the
know.
child, yeah.
Yes. So to prevent that, then I do advise going to the gynecologist at least once a year, you know. And whenever they give you your like contraception, you can always take it at the clinic. Like contraceptions are readily available
Mm,
everywhere. Yeah, at the clinic. If you want to go to private, then okay, your gynecologist will write a script for you, and then you can always get it from the pharmacy. But contraceptions are free, you know.
yeah, yeah.
Yeah.
No, but that's interesting. Can I tell you,
Mhm.
I have a general, my GP.
Mhm.
Every time I say should I go see a guy now, he goes for what, and then he just like brushes it off. So
Yeah.
for me, it's, and then after that I like do the whole how much is a GP special, not a GP,
Exactly.
how much
Consult.
would it cost me to see a
Yeah.
gyna, and it's like charging me 2 million rand, and then you're just like, oh my gosh. So then it becomes very tricky, because then you're like, firstly, is it necessary if this guy said don't
Mm.
go? And then like it also costs an arm and a
And
leg to
then,
actually just to get for the first consultation, Jay. And
yeah,
then you're just like, oh my gosh, it's a lot. So
yeah.
yeah, that's, I think that's like one of the causes as to why I would, well, I've been to the gyna once, but
Mm.
yeah, that's, it's tricky. You guys need to do better.
Yeah. No, I mean, okay,
Yeah.
in the sense also your GP is right, because I mean, we are all GPs in the sense when we graduate medical school, So if it's
Mm,
for minor things, then yes, you don't really need to go to a gynecologist, because a GP can always do that. You know what I mean?
yeah.
But if you're having issues with your reproductive health, in the sense that
Mm,
you have got persistent, like we were talking about endometriosis earlier on,
mm.
a GP will only suspect it, but a gynecologist will definitely do the recommended tests that are needed to actually, right, confirm.
So I guess from this conversation, what I'm getting is that if we educate society, I don't want to say if we educate women only, if we educate men and women, we also we empower directly and indirectly, we empower the woman, because then if a person is not being beaten up and getting HIV and AIDS because they are forced to sleep with this old man, or if they're going for regular checkups and using contraceptives, then they're basically enabled to participate in empowering themselves. So, for example, they can show up to school, they can show up to work, and basically, like what you said, linking back to your initial definition of what empowerment is, they can be independent, socially, financially, physically, they can show up for themselves.
Yeah.
And in turn, then we basically contribute to a woman being empowered. And yeah, so that's basically what I wanted us to have this conversation, because I don't think we highlighted enough that just the small things, not small, but then the overlooked things that we see in society, and how that directly affects the woman's participation in making the economy in making the economy better, or society better. And I don't think men actually understand what they're doing to us when they do certain things. So this was important to just highlight that. So before I let you go, I have two things. Firstly, um, what what phrase or song
Uh-huh.
keeps you empowered as a woman when you face like different challenges? So you are a doctor, you mentioned that certain things that you do have an adverse effect on your mental being, and sometimes your overall being. What would you say is the one phrase, or what keeps you going? Do you have a song, do you have a quote like that you can share with us that keeps you going?
So for me, what has always kept me going since I was, I don't know, since I could read the Bible, was
Mhm.
Philippians 1 verse 8. I can do all things through Christ who gives
To
me
Christ
strength.
to strength. Oh, that's powerful. I love that verse. That is
That
powerful.
that has always been my go-to verse. Like if I have to forget anything, like all the scriptures in the Bible, I don't think I can ever forget that one, because it is to
Yeah.
Him that I relay my strength to. In terms of a quote, well, I don't know if someone has a. It was that quote. I've forgotten the movie where this black lady was telling a kid to say, "I can all do all things, but I can do it
Oh,
no."
yes. No, I can do what a man can do, but what women can do anything a man can do, and even better, or something like that.
Yes, something like that. So for me, it's always because sometimes, like I mentioned earlier on, you as a woman, especially, you go through these adversities. I mean, these I shouldn't call them adversities, but these
Challenge.
challenges where people look down on you and they think, ah, but it's just a female. Ah, it's a black lady. Anyways, what does she
Mm,
know?
mm,
But then I
mm.
can say, give me a chance and I'll do it better than you. You know,
Exactly.
see what I
Exactly.
can do. They judge my works and not because of how I look or what I am. So yeah,
That is true.
that's
Give me a chance to show you my capabilities. Yeah, it's wild that this is the world we live in. But you know what? With females and women like you on the forefront, we are going to conquer. Well, on behalf of everyone, well, thank you so much for taking your time to talk to us and let us in on the gems that you dropped today. We appreciate you and all the best. I'm sending you a lot of love and strength. It can't be easy doing what you do, but we appreciate it.
Thank you so much, and also thank you for the invite. Never done
You
this
are welcome.
before. Hopefully, I did well.
You did amazing, sweetie. You did amazing.
Thanks. Invite us
Alrighty.
next time.
And you'll be hopefully when the world gets back to normal, we'll be like sitting in on a round table, the red table type of situation,
And have
and
an
we'll be talking
entanglement.
about entanglement. Oh my god. All right. Thank you so much for listening to
Okay.
Adulting Anonymous. Catch us in the next episode.